During the COVID-19 pandemic, one group faced a really unique and, at first, kind of overlooked threat. So today, we're going to dig into the severe risks the virus posed to pregnant individuals and their babies. We'll unpack the science, the devastating outcomes, and the critical lessons that we just have to carry forward.
And that brings us to the big question, right? Why did the very act of creating a new life suddenly become so incredibly risky during the pandemic? Seriously, understanding this is the key to everything else we're about to talk about. All right, so let's jump right in. First, we've got to understand how this vulnerable group even came into focus and why they needed such urgent special attention.
So if you think back to the early days of the pandemic, the full picture of who was at risk was still, developing. But by the middle of 2020, a really worrying pattern started to emerge. And wow, by the end of that year, the evidence was just undeniable. Pregnant women were being hit disproportionately hard by this virus.
Okay, but what does disproportionate risk actually mean for a person, for a family? The specific outcomes for both mother and baby were, frankly, alarming. And that's exactly where we're going next.
This is a really tough snapshot of the danger. It's a lot to take in, I know, but the key takeaway is crystal clear. From the mother's health to the outcomes for their newborns, what's known as perinatal outcomes, the virus was having a devastating impact right across the board. Let's just pull out a couple of key numbers here.
Okay, let's drill down on one of the most alarming numbers. Pregnant patients of COVID-19 were over 2.5 times more likely to end up in the ICU compared to their non-pregnant peers. I mean, that's just a staggering sign of how incredibly severe this disease could get.
And so tragically, that danger didn't stop with the mother. Babies born to mothers who had COVID-19 had a more than doubled risk of neonatal death. It wasn't just a threat to one person. It was this dual threat, putting two lives on the line at the exact same time.
So all of this just begs the question, why? Right? What was actually going on at a biological level to create this perfect storm of vulnerability? Well, that brings us to Section 3, the body's battleground.
Well, the whole story really starts with this one key player, the ACE2 receptor. The easiest way to think about it, it's like a doorway on the surface of our cells. It's the main entry point the virus uses to get inside and, hijack everything.
And you can see here just how that works. The virus's spike protein acts like a key, and it's a perfect fit for that ACE2 receptor, the lock. Once it binds, boom, it gets into the cell. It's a really simple idea, but that's it. That's the critical first step for the virus to get in and start causing trouble.
Okay, so why was this doorway such a huge deal during pregnancy? Well, it basically created a perfect storm for 3 reasons. First off, the placenta is just packed with these ACE2 receptors. Then, the infection injures the lining of blood vessels, which creates something called a procoagulable state. That's a fancy way of saying blood is dangerously more likely to clot. And finally, the unique immune system of a pregnant person can totally backfire, leading to this overwhelming, disordered inflammatory response. Now, you might be thinking the virus was just passing directly from mother to baby, but direct infection of the fetus was incredibly rare. We're talking less than 3% of cases. But that wasn't the real danger. The real threat was the mother's own body launching a massive inflammatory response that created a hazardous, dangerous environment for the developing baby. So yeah, it was an absolutely frightening picture. But the scientific and medical communities, they fought back. So how'd they do it? How did they start to turn the tide for this incredibly vulnerable population?
It really came down to one thing, the absolute game changer. The intervention that offered a powerful shield was vaccines. And the impact was just dramatic. mRNA vaccines proved to be 83% effective at keeping pregnant women with COVID out of the hospital. I mean, that is a powerful, powerful shield, right when it was needed most. So vaccination was absolutely key for prevention. But what about for those who did get sick? Well, a really clear clinical pathway started to emerge. Everything from supportive care like fluids and oxygen to steroids to calm down that inflammation, all the way to advanced therapies like mechanical ventilation for the most critical cases.
So, after all of that, what did we learn? What are the big takeaways from this really intense chapter of the pandemic? That brings us to the most important question of all. What lessons must we carry into the future?
One of the toughest lessons was about global inequality. The pandemic put this harsh spotlight on the fact that where you live dramatically changes your chances of survival. The disproportionate deaths in lower and middle-income countries, made even worse by a failure to get vaccines out to everyone equitably, was just a profound failure on a global scale.
And so, when you take all of this into account, the science, the numbers, the wins, and the losses, it really leaves us with one final urgent question for all of us to think about. After everything we've learned, are we truly prepared to protect the most vulnerable when the next pandemic arrives?